Guys, in this video, we want to look at Ebola. Basically, before we go into that, just note that there is vaccine for Ebola now from 2019. That is the ZEBOV vaccine. Okay, Zaire Ebola virus. There is vaccine now. So the vaccine was approved for medical use in 2019, guys. So just note that there is vaccine. Now let us get into the details of Ebola. So people in community medicine exam, they can ask you Ebola and prevention, etc. So basically, what does Ebola virus cause? It causes Ebola virus disease. Earlier, it was called as some hemorrhagic disease or something. Now, this is the word, okay? Ebola virus disease. So this is your Ebola virus. So basically, new infectious disease recognized when, 1976, 77 they have written here. So you have to remember, 1977, they recognized this Ebola virus, which causes Ebola hemorrhagic fever. But now they are calling it as what? Ebola virus disease. Okay, guys? Very good. So it's a new infectious disease recognized when in 1977. So many diseases are there. One of them is Ebola. So basically, it is a new breed of deadly hemorrhagic fevers, Ebola virus disease, previously known as Ebola hemorrhagic fever. Deadly hemorrhagic fever it is. Okay. It is most notorious and has struck in Africa. When did it come first? In 1977, they said, right? Okay, they came in 1976. Okay, they recognized 1977, looks like. It appeared where? In Zaire and Sudan. Where is it? In Africa. Where exactly is Zaire and Sudan? Do you know? There's no Zaire now. It is called as Democratic Republic of Congo. And then this is Sudan. I think they have Sudan here and South Sudan. So which one exactly are they referring to? And there's a Congo Republic here. And there's a Democratic Republic of Congo. Wow. So I think somewhere here, guys, and somewhere here it started. What started? Ebola. 1976. Zaire and Sudan. Okay. What is the Central Africa, is it? Since then, it is appearing periodically. It is appearing again and again. That's what you have to remember. Okay. So basically, the recent epidemic, when did it happen? December 2013. Recent epidemic was there. Again, 2015, okay, by 2015, 25,000 cases were reported with 10,000 deaths. The fatality rate is as high as 70%. Okay, where did it come in December 2013? Guinea. Okay. So it came where? In Guinea. Now, where is Guinea? See here, this marked in red. So somewhere here, you see, in red, they have zoomed it here and shown. This is Africa and this is Guinea. So this is where the December 2013 outbreak started. First where? Zaire, Sudan, then so many times it started recurring, and in December 2013, Guinea. So basically, what is this? This is a filamentous virus, Ebola virus. It is RNA, negative sense, single-stranded RNA it has. Basically, it's a member of this Filoviridae, they are saying. Let us see our classification and then. Guys, see this? Ebola, filoviruses, single-stranded RNA, negative sense. Okay, it's already put here. See this? Ebola virus, filamentous shaped electron micrograph. Okay, so it is coming under filoviruses, single-stranded RNA, negative sense. We'll just go with this. There are 5 distinct species, guys. You have the Zaire Ebola virus, ZEBOV, REBOV, SEBOV, ICEBOV, BEBOV. Zaire Ebola virus, this is the most virulent. Guys, can you see these names? ZEBOV, REBOV, SEBOV, Sudan. Zaire and Sudan is where it started, right? Okay. Then some Ivory Coast is there. Bundi Bugyo Ebola virus, BEBOV. Okay. So 5 names are there. Okay, guys. Do you want to remember these names for marks? Just remember at least Zaire, Sudan. Okay. Try to say these names, guys, in your head.
Zaire Ebola virus, ZEBOV most virulent. Western Ebola virus, REBOV. Sudan Ebola virus, SEBOV. Thai Ebola virus, Ivory Coast. ICEBOV. Bundibugyo Ebola virus, BEBOV.
Let's continue, guys. What are we looking at? Ebola virus. So basically, this disease, how it comes, direct contact with blood or secretions, body secretions. So both things you have to remember. Direct contact with blood, organ, body secretions, body fluids of infected animals like chimpanzee, gorilla, monkey, fruit bat. Okay. But human to human, how it is going? Human to human, it is going in blood and body fluids. Okay. and that too a symptomatic person only is infective. That is a very nice thing about Ebola, don't you think, guys? A symptomatic person only is infective, which is very nice. Asymptomatic guy will not infect others. Okay. See, in HIV, what happens again? Blood and body fluids, but an asymptomatic person can give you the disease, right? But here, asymptomatic cases are not infective. People in incubation period, they will not infect others. This disease is not transmitted through air, water, or food. Kind of, so if you know somebody has a symptom, catch hold of them, isolate them, then the disease will not spread to others, kind of a thing, which is nice, I feel. Okay, so what did you look at now? Chimpanzee, gorilla, monkey, fruit bat, all these people can give the virus to you. And similarly, human to human. These things are really good, some green points. Then we are moving on to human to human. What did you see? Again, blood and body fluids, infected symptomatic person, needles, etc. Very similar to HIV, kind of looks like to me. Then infected secretions. Guys, how do you feel about Ebola? Okay. So what will happen if you get this disease? Sudden onset of fever, intense weakness, muscle pain, headache, sore throat, vomiting, diarrhea, rash, impaired kidney and liver functions. Wow. And internal external bleeding. So this is what is that hemorrhagic fever, right? Hemorrhagic. Is this what they're referring to? And the case fatality is as high as 70%. This is the only negative thing, right? 70% case fatality. Okay. Lab diagnosis, they'll have to check these secretions. It looks like in a biosafety lab for real-time PCR they will do. What is the treatment, guys? Currently, there is no specific treatment. So basically, they will give support. Intensive supportive care they will give. Mortality can be reduced and spread of disease can be prevented, right? Basically, that's what they are saying. Spread of disease you can control. Shall we take a recap, guys? Guys, do you wonder what exact national program is there for, not specific, but at least where you can cover this? Under National Health Mission, Communicable Diseases Control Program, you have vector-borne disease. This is not vector-borne. This is not tuberculosis. This is not leprosy. What about this one? Integrated Disease Surveillance Program, IDSP. Let's check this one. Integrated Disease Surveillance Program. Integrated Disease Surveillance Program, National Center for Disease Control. Okay. See here, they're talking about outbreaks, disease alert, outbreaks, and some influenza. So currently they're focusing on COVID-19. Okay. Is there Ebola in India, guys? Looks like they have screened people for Ebola. Anyways, guys, for National Health Program, for you write Integrated Disease Surveillance Program. Integrated Disease Surveillance Program. Integrated Disease Surveillance Program, IDSP. Okay. That's the only thing we can write here, looks like. Let's take a recap, guys. So in this video, we wanted to look at Ebola. Ebola virus causes Ebola virus disease. It's a new infectious disease recognized 1977. It was earlier called as Ebola hemorrhagic fever. It started in Zaire. Now it is the Zaire is called as Democratic Republic of Congo and Sudan. In 1976, it appeared first. Basically, it is most notorious. Very notorious it is. And since then, it has appeared periodically. It recently in 2013 there was an epidemic in Guinea and then it spread to South Africa. About 25,000 cases were reported by 2015 April, 10,000 deaths. The fatality rate is as high as 70%. That's why it's notorious. Ebola virus is basically a filamentous virus, single-stranded negative sense RNA virus. It's a member of Filoviridae, which comes under your miscellaneous viruses. It has 5 distinct species itself. Wow. Zaire Ebola virus, Reston Ebola virus, Sudan Ebola virus, Thai Ebola virus, Ivory Coast or something they were calling it as, Bundi Bugyo Ebola virus. So, ZEBOV, REBOV, SEBOV, ICEBOV, BEBOV. Ebola virus, basically, how does it come to you? By direct contact with blood, organ, body secretions, etc. Body fluids, etc. of these animals who are infected, like chimpanzees, gorilla, monkey, fruit bats. Human to human, it can happen similarly, body fluids, body secretions, etc. And people are not infective during the incubation period of 2 to 21 days. Asymptomatic cases are not infective. It is not transmitted via air, water and food. Okay. So that's a good thing, right? Moving on, what did we see? We saw that what will happen if you get this disease: fever, intense weakness, muscle pain, headache, sore throat, vomiting, diarrhea, rash, impaired kidney and liver functions, and these people will have internal and external bleeding. Okay. Then case fatality rate as high as 70%. So this secretions, I think they will check. So lab diagnosis will be done in BSL Biosafety Lab 4, and they do real-time PCR. Okay. Treatment, there is no specific treatment, only intensive supportive care is there. You can prevent the disease by having infection control measures. Infection control measures you should have to prevent the spread. In India, the communicable disease programs, you have many, and under that you have integrated disease surveillance program, IDSP. That's all for now in Ebola. Bye bye.